Hi, and welcome to another edition of Feel Great Today with Dr. J. My name is Dr. Jason Skolar, and I am a chiropractor that specializes in the field of manual medicine. And chiropractors are experts in the field of manual medicine whereby they use specific manual therapeutic techniques that are designed to stimulate the body's own ability to heal itself and overcome problems that conform to a whole wide range of issues that can take place within the body. A question that I'm commonly asked in my clinic is, when is it appropriate to use ice versus heat therapy? And it's a very, very good question because often patients come to my office after going to the emergency for acute care and they are given erroneous advice. And it's important that after an injury, you actually use the right mode of therapy if you want to feel better and not make your problem worse. The general rule is as follows. For any type of trauma, any type of acute trauma, a fall, a sprain, a strain, sports-related injuries, collision-type injuries, motor vehicle accidents, any injury that occurs where inflammation will result and tissues will swell, and pain will often follow as a result of this acute inflammatory process. So in short, any type of injury that occurs to the body that will provoke and trigger an inflammatory response, it is warranted to use ice. You do not want to apply heat. Often patients come to my office after going to the emergency room for a particular injury and they're told that you should put heat on it and go home and take some anti-inflammatories. And in fact, heat would be contraindicated in the event of an acute injury because acute injuries for the first 72 hours and often between the first 3 to 5 days, there is an inflammatory process whereby fluid accumulates within the tissues. And if you apply heat to this problem, you're going to be increasing vasodilation, you're going to be increasing blood flow to the area, and in fact, you're going to be provoking inflammation. It would be similar if one were to pour gasoline on a fire. This would make it worse, and this would occur if heat would be applied to an acute injury where there's swelling in the body. So you do not want to apply heat to an acute injury. You would want to apply ice because ice will do two things. It will reduce swelling and it will reduce pain. Ice is a very effective analgesic and a very effective natural anti-inflammatory. So the general rule is as follows. For any type of acute injury, any acute type of trauma, motor vehicle accident, sports-related injuries, faulty movements, sprains, strains, pulled muscles, you want to use ice, not heat. Heat would be very useful in the event that we are dealing with very, very tight muscles. Chronic muscle tension responds very, very well to heat because the heat will increase circulation in a given area and will increase the elasticity of the muscles. So chronic muscle tension, muscle spasms, osteoarthritic changes respond very well to heat. It's interesting because disc herniations, which I'm going to speak about in another episode, are very painful and very debilitating for a lot of people. And it's written in the medical literature that people who suffer from disc herniations should use ice. And with over 10 years of clinical experience in practice, I initially started recommending that patients apply ice, and I noticed that people were not reporting to feel better with ice therapy, also known as cryotherapy. And then I decided one day, I'm just going to have them use heat. What's the worst that can happen? The worst that can happen is that a person may feel a little bit worse. And how much worse can it get when a person comes in basically on their hands and knees in debilitating pain? So I tried that. I suggested heat. And guess what? people responded instantly to the heat therapy. So now, general protocol at the clinic, people who come in with disc herniations, I will recommend heat because with extensive clinical experience, people and patients in general respond better to heat for disc herniations, which I'm going to speak about in another episode. So chronic muscle tension, muscle stiffness, muscular spasms, osteoarthritis, osteoporosis, disc herniations, these are the instances where one would want to use heat therapy. If you're not sure and you're in a situation where you're in pain and you don't know what to use, it's always best to use ice because it will not worsen with ice. Chances are you will feel better. But if you want a specific protocol, as I mentioned in this video, these are the steps to follow. Thank you for tuning in. I hope you enjoyed the information. If there are other topics you'd like for me to discuss, please feel free. I can be reached at www.drskolarchiro.com. DRSKOLAR Chiro.com. Thanks and have a great day. Bye-bye.